So to begin, I'm going to knock on the door, identify and greet my patient, wash my hands, and provide for privacy. Hi, Miss Jones. Miss Jones. My name is Tiffany. I'll be your nurse today. Can you verify with me your name and date of birth? She's got a little wristband, and it says Valerie Jones, 11/9/81, so that's right. And I'm going to be on standby, and I'm going to put on gloves. For when the baby is born, so that I'm ready. And the baby is born, so I'll bring the baby over here. And I'm going to be washing the baby off. And I'm going to be stimulating reactions, so rubbing the soles of their feet, rubbing their back, cleaning them off. Okay, and so now I'm going to put a hat on the baby. This isn't really a baby hat. Okay, and then I'm going to put a diaper on the baby. And I'm also going to make sure that the baby is positioned with the head tilted downward to promote the drainage and secretions from coming out. And the baby will be up underneath a warmer. Okay, and then I'm going to suction the baby's mouth and suction the baby's nose. So I'll go in the side of the mouth and I suction, suction, and suction. And that's good. And I'm going to go ahead and I'm going to do the APGAR scoring, which my APGAR score is right here. Because it's going to be above the bed, or above the warmer. So first we're going to look at activity, and it's on a scale from 0 to 2. And so the baby is pretty active, flailing around, so we're going to give her a score of 2. And I'm going to go ahead and listen to her heart rate, her pulse. And I'm not going to put the right in my ear because I have an ear infection, but I would put both the sides of the stethoscope earpiece in my ears. Okay, so the baby's heart rate is over 100, and typically you want their heart rate to be 110 to 160, so she's also going to get a score of 2. I'm going to stimulate a reaction. If the baby grimaces, that's good, and she responded to all my stimuli, so she's going to get another score of 2. Overall, she's pink in appearance. She doesn't have any blueness of the extremities or acrocyanosis. And as far as respiration goes, very vocal baby. She's crying, so she's also going to get another score of 2 on both appearance and respirations. So the baby got a score of 10, which is really good. So at this point, I want to get all of the wet stuff out from underneath to prevent cold stress. And I'm going to go ahead and I'm going to check the umbilical cord, make sure that I see 3 vessels, and I do, so that's good. I'm going to go ahead and wipe the baby's eyes off, so make my mitt here. And go from inside to outside, using a different part of the mitt each time. Inside, outside, inside, outside, inside, outside. Okay. And so now what I'm going to do is I'm going to go ahead and get the baby's temperature up underneath her arm, and I'm going to get her wristbands ready. And I'm going to make sure that I verify these with the moms. So Valerie Jones, 11/9/81, and Judy Jones, 11/9/81. So I know that the wristband matches the mom's. And I'm going to put 2 on her because the babies usually lose one or two, so it's good to have both these on. Temperature's good. And then I'm going to go ahead and I'm going to administer her eye drops. So I'm going to put them from here to here in the conjunctival sac, here and here. And I would give her vitamin K shot in her thigh, so I'm going to give her that. And that is it. I'm going to wrap the baby up, give her to her mom for kangaroo care. I would wash my hands, take my gloves off, wash my hands, make sure the mom had her call button, ask her if she has any questions about breastfeeding or kangaroo care, make sure she's fully educated on that. And then I would tell her I'd be back to check on her in about half an hour. If she needs anything to call me, take my gloves off, wash my hands, provide for privacy, and go document.